Hi, my name is Megan, and I will be presenting on the second trimester, which is weeks 13 through 26. Hi, Amy and Jake. I want to welcome you to the office today. My name's Megan, and I'll be the nurse practitioner that'll be discussing with you the second trimester of your pregnancy. In regards to the second trimester, it is weeks 13 through 26, and things we'll be discussing today are physical and emotional changes that happen, normal symptoms, things that may need medical attention, and we'll also be talking about lactation, which is breastfeeding. So, Amy, if you first off have any questions during this, I want to let you know to feel free and ask about them. And if you think of questions when you're at home, I would encourage you to write them down, or if you feel that they need to be answered urgently, you can always call our office. But I also wanted to let you know in regards to the physical change in the second trimester. There's a whole list here. I'll go over a few of these, and then we will also give you a list when you leave the office today. But oftentimes you'll notice that your belly will get bigger, that you'll have skin changes. You could have inflamed gums. You could experience constipation because the baby is starting to push on the bowel. You could have sore legs. You could begin to see stretch marks. One thing I do want you to kind of pay attention to is if you get any UTI symptoms, such as urgency, frequency, burning with urination. Now, you may get frequency because a lot of times the baby can press on the bladder, but just kind of monitor your urinary symptoms because if you do get a UTI, we want to get that treated as quick as we can. You'll also want to monitor swelling, and you'll notice hopefully that your nausea will lessen, but you may start to get nasal congestion. And you may get dizzy, and so just kind of monitor that. If you do have any questions whatsoever, do not hesitate to give us a call. The next thing we'll talk about is the emotional changes that happen in the second trimester. Now, Amy, you may still be feeling some anxiety and depression, and that's normal. So don't think you're any different than any other pregnant woman. In regards to the emotions, we're hoping that they will become more stable in the second trimester. We're also hoping that you will have more energy and less fatigue. And the awesome thing about the second trimester is that being pregnant, it kind of becomes a little bit more real in the second trimester because you're starting to show and you can also start to like celebrate. And what we recommend is that you and Jake talk to the baby, and that you may want to keep a journal just so that you can go back and it can be something fun. And one big thing is we want to encourage you to make sure that you're taking care of yourself, Amy, by doing things that make you happy. Now I want to touch on when you need to get medical attention quickly. So if you feel that something is wrong or you are nervous about something, you know your body best, Amy. So give us a call. We'll get you in, we'll get you taken care of. If you're feeling unusual or severe cramping or abdominal pain, call us. If you're having a hard time breathing or you're having shortness of breath and it gets worse over time, call us or go to the nearest emergency room. Some signs of premature labor, like your water breaking, is any leakage of fluid. So you need to be aware if there is fluid leaking. Now, there is a difference between fluid leaking and vaginal discharge. And the fluid will literally feel like you wet your pants. In regards to contractions, so if you feel tightening or pain in your lower abdomen and it happens 4 times in an hour, you need to contact us. So I wanted to go over kind of a comparison of what normal looks like versus contacting us. So if you're having morning sickness and you're vomiting, you know that's normal. But if you can't hold anything down and you're not able to keep anything down for several days, call us. If you have vaginal discharge, that's normal. And if you're having leaking amniotic fluid or your water breaks, that's abnormal. It's normal again to have vaginal discharge, and it's a totally different story, and you need to seek medical attention if you see bleeding or spotting. Amy and Jake, we are going to be going over tests and evaluations that will be done during the second trimester, and nutritional advice for the second trimester, safe exercise guidelines, and emotional self-care strategies. Ultrasound is one of the first tests that we recommend during the second trimester. Ultrasound is used to be able to tell the gender of the baby, and that is usually done at 20 weeks. It can also be done to see if there's any abnormalities with the fetus. The next test that we'll do in the second trimester is gestational diabetes test, which is used to determine if Amy has gestational diabetes. And it is determined when one or more of the glucose values on the test fall at or above the glucose threshold. The third test we do is called an RH factor, and this is done because if the mother has RH negative and the baby has RH positive, then the mother needs to get an injection to prevent the attack of the fetus's red blood cells. The next test we'll do is a CBC, which includes a hemoglobin and a hematocrit, and these are done to test for anemia. And Amy, if you have anemia, we will treat you for it, and so don't worry, there is a treatment for that. The last test we'll do during this trimester is we will recheck for syphilis, because if you are positive by chance, you will need to be treated immediately in order to protect your baby. I always like to go over nutritional advice and exercise guidelines for pregnant individuals. It is recommended that you exercise 20 minutes a day. Walking and swimming are the safest, and we recommend that you avoid contact sports and anything that you could have a risk of falling. Also, you want to maintain a healthy lifestyle, eat nutritional food, make sure that you're taking your prenatal vitamins, and the most important one is to make sure that you make every prenatal appointment. I also want to make sure, Amy, that you are taking care of yourself emotionally. So there are a few recommendations. Now we have a whole list here. I will go over just a few to hit the basics. I recommend that you do prenatal yoga because this helps with your physical health. It can decrease your aches and your pains and your discomfort. It lowers your stress and anxiety. And then meditation, it helps to reduce your stress, reduce anxiety, and it can help you to build your emotional resilience. And then also breathing techniques, because this can help you to manage your pain during labor. And last but not least, the one that I want to touch on is prenatal Pilates, because this helps build muscle, prepare you for labor. It helps you to control certain movements, and it helps you to learn breathing techniques. One resource I really would recommend for you guys, where you guys are first time parents, is going to an educational class put on by Intermountain Health. It costs $90, and that's for the both of you to go. It's 6 classes, 2 hours each, and they do offer virtual and in person classes. The website is below, and you can just go to that website to register. But they teach you about pregnancy, labor, interventions, coping after birth, and breastfeeding. Now, Amy, I know that you are a little bit anxious about breastfeeding, so I wanted to give you the benefits of breastfeeding for you and for the infant. For you, it lowers your risk of ovarian cancer and breast cancer. It lowers your risk for type 2 diabetes, and it decreases your blood pressure, and it does more. Benefits for the infant: a lower risk for infection, lower risk for obesity, lower blood pressure, and fewer incidences of respiratory infection, diabetes, and asthma. For some lactation challenges and tips, if you have nipple soreness, you can always keep the nipples moist by applying olive oil or expressed milk or ointments, because if they're cracked and dry, they're going to hurt. If it is hurting while you're nursing, you can always put your finger in the baby's mouth and release the suction. If you have breast engorgement, it is recommended that you feed the baby at least 8 times in 24 hours for 15 minutes each. You can also express the milk manually and use warm water and cold compresses. In regards to not having enough milk, if you are concerned there, you can make sure that you're getting adequate rest, that you're feeding the baby frequently, that you're eating nutritiously, and that you're getting enough fluids. And if you feel like you have a plugged duct, you can massage the area and apply gentle pressure to release that. Jake and Amy, I want to thank you for your time for coming in today and discussing lactation in the second trimester of your pregnancy. Amy, I wanted to also reassure you that you don't need to worry about not having enough milk. As you are eating nutritiously, drinking enough water, your milk will come in. I would encourage you, when you do have the baby, to feed your baby frequently. And if you have position issues, let me know and we'll work through those. I also want to let you know that I am here to support you. And if you feel like you need further assistance with breastfeeding, there are lactation specialists, and we'll be happy to refer you to them. Thank you. And here are my references.